Once again, thank you so much for being here, Dr. Ravi Teja. Um,
Yeah, thank you.
so we're Med Veda. We're a student-led organization aimed at providing STEM enthusiasts with opportunities to uh discover the medical field basically. And we're so glad to have you here to share your experience and your advice, having been a professional in the medical field for so long as in the sports medicine field and as a knee surgeon. So please go ahead.
Yeah, thank you so much. Firstly, I would like to thank each one of you for kind of recognizing my expertise as well as the experience, and I would definitely think that whatever I shared today would definitely help you and people like you who are kind of thinking towards making something big in this world. So I'm Dr. Ravi Teja Rudraraju. I work as a complex knee and a sports medicine surgeon at Apollo Hospitals in Hyderabad. So a brief introduction about me. I've done my residency in orthopedics in 2017 and traveled to South Korea for a brief period of time. Did my uh, hip and knee joints fellowship. Later, I traveled to US. I did my sports medicine fellowship in Cleveland Clinic and then worked for another year in Geisinger Clinic in Central Pennsylvania. After that, I had an opportunity to travel to Australia. I did my robotic joints fellowship in Melbourne, and I was there for a year, and then also traveled to Sydney. I stayed in Sydney for a year doing my knee fellowship. It's a comprehensive knee fellowship focusing on sports medicine as well as joint surgery. So, having 5 years of travel experience in different parts of the world, I came back to India a year ago and established myself as a orthopedic surgeon, focusing mainly on sports medicine as well as knee surgery. I've had a great time traveling across the continents. Uh, Definitely, one thing I'm proud of is that I'm always interested towards innovation and kind of doing something different than the regular kind of practice that we do. So I've tried myself pushing myself towards research. I've published a lot of research articles in high index journals when I was in Cleveland Clinic, also in Australia. I published in a couple of well read journals. Also, I'm very interested in becoming an entrepreneur um, during my residency days. So I also kind of thought through various kind of innovative ideas, but back then it was all in the idea form. But I think during my journey across various places, it made me understand how an idea can be translated into something as a product or probably into something that will be useful for people. So I think in that scenario, we have thought about what's the existing problems in musculoskeletal arena. So, as an orthopedic surgeon, so I usually do all sports related injuries. So, we kind of help athletes, sports people, as well as normal public who suffer through, ligament injuries or any sort of sports injuries. And then we help them recover, and also, we help them get back to their life, whatever it is. So, in that aspect, I think there's a great scope for technology and innovation. So um, what we try to focus is that how kind of a tech-enabled uh, management of any problem can add value to patients in terms of their recovery as well as when they go through all this painful process. The conventional way, even now, how we kind of help patients is that we patients come to us, we diagnose them with problems, and then we advise them either to kind of undergo a surgery or probably to take rest and get back to normal. But I think as we go forward, I think two things are becoming more and more important. One is data, which is what each patient's you know kind of unique presentation is all about. So when we talk about data, start from sex, age, obviously type of injury that they go through, and the way they recover in various places. So I think when I kind of traveled through Cleveland Clinic and also in Australia, saw that particularly with orthopedic problems, usually these patients need support and needs time to get to normal. So with my mentors in US and Australia, we started thinking about if we can develop a application which could be accessed on their mobile device on what to do, what exercises to do, and kind of having reminders at a periodic intervals of asking them whether they have done their exercises today, how are they doing, whether the recovery is comfortable or not, and kind of having a live feedback from the patient side is of immense value. So we have developed some applications on specific injury recoveries. Say, for example, if someone has got a knee injury playing soccer, or probably someone has undergone a knee replacement surgery for arthritis. So we explain them that surgery is a part of it, but the whole recovery will also consist of exercises that they have to do for the period of 1 month to 45 days. So we have given an app that has customized exercises which they have to do every day, and obviously they kind of record it and give feedback saying that whether they have done completely or not, whether they have any problems, and what is the experience in terms of recovery in the over the period of time. So that is one part. And the second one is whether the patient is doing as we ask them to do. That is something that can be always be biased, right? So a patient can say that I have done it, and surgeons might think that may not do it. So there's a kind of a gray area there. So we have also innovated to integrate a wearable device like an Apple Watch or probably a sensor enabled device which can kind of track the recovery on whether the exercises that we ask them to do are being done appropriately and on the right kind of way. So I think with that ecosystem, I think what we have been seeing is that patients definitely engage themselves well, because now they clearly know that the data that whatever they are doing is being recorded, and that can be also kind of helping them in terms of having a better recovery. So that is one thing that what I'm kind of trying to do at this present stage. So I mean, I just kind of mentioned this thing because, see, as a surgeon, I can just practice, I can just treat my patients, and I can just live my life as any other doctor. But it's important to kind of think out of box on how we can solve problems to patients, and how using technology, how using innovation and technology can help patients recover better. We didn't have this kind of an infrastructure probably 10, 20 years ago. So as a medical professional, as we are in the field of medicine, it keeps changing every day. So you have to kind of innovate in such a way that you use the existing resources and kind of brainstorm to bring out a unique solution that will help the human or the mankind, right? So I think it's important to crack exams, it's important to do well in exams, it's important to get into good colleges, get into the right residency, and probably I think that's all definitely important. But more important than that is to think innovative, think out of box, and start looking for resources that will help you whatever you want to do it. It cannot happen on day one. It can take some time. You might fail a couple of times, maybe many times, but all you have to do is to be successful only probably a single time. Once you are successful in your lifetime, then definitely you're an achiever, right? So you don't have to do something great every single time. Even if you do one thing really great, I think world will appreciate it, and it will definitely reward you with money, fame, wealth, whatever you name it. So um, I think, probably I think that's kind of an attitude that we have to develop while we are kind of looking for medicine as a profession. Along with that, I think important thing is to always stay connected to your patients or to whomever you are kind of treating, right? So then only you'll understand the real problem. So as a doctor, as a medical professional, although money is important, and probably the kind of a lifestyle that you expect or whatever, so those things will only follow when you are passionate about what you do. So in that aspect also, I think once you become a doctor and start practicing, every day you should think about how can I make my patient's life better than yesterday. So you have to always push yourself to kind of be a better doctor, give a better service, and help them recover better. So that should be always the motive. And also, I think I'm sure you guys might have heard of term called alchemy, right? Alchemy is as it described in the dictionaries or in the literature. A metal can change from an iron to gold, or like into different elements. Similarly, I think when we kind of put that word into our perspective, it's important to understand that you have to kind of look for different domains of thinking. So if you, I think, follow Warren Buffett and Charlie Munger, they call it the mental models, right? The first principles of thinking. So you have to always cut down the problem into simpler things, like what's the basic problem that's leading to existing issue. When you cut down things to a simpler issue, then you kind of restructure it back or re-engineer it back by looking for solution in other fields. Probably you can look into engineering, probably you can look into something else, like so if you kind of understand then how to think from the mental models or the first principle thinking, then you can always come up with great solutions. Steve Jobs or any other great technology innovation that came in the last century is all out of simple thinking, starting from simple thinking, right? So there were Nokia phones existing, amazing phones that kind of ruled for a decade or more than that. But a kind of smartphone like Apple kind of completely changed the direction in which we use the mobile phones today, right? So we have to kind of go back to that simplistic way of thinking, like the new kind of a solution which can all change the perspective of a person to people, thereby the whole world, right? So if there is a problem existing in a patient in your, like, probably a clinic, so that if you innovate and kind of come up with some solution, then that applies to any part of the world, like any patient, any part of the world can also kind of use that solution. So I think as youngsters, I would really encourage you to kind of work with different people, like not just with your friends who are from the medicine front only. I think start interacting with engineers, start interacting with various domains people, so that like, say for example, in this kind of my example, I kind of worked with different people, like Dr. Thomas, who's my colleague and chief physiotherapist. So me being a surgeon, I really don't have deep understanding of how patients recover in terms of surgery, after surgery. So when I interact with my physiotherapist, he gives a lot of different perspectives to me, of because he has been seeing the recoveries since many, many years in his patients. Similarly, I work with some kind of a technology guys like who has done engineering as masters, who's from IITs or good institutes, and who are also kind of innovative guys. How technology can play a role, and that's how we ended up, integrating a wearable device into our recovery program. And similarly, there was one of my cousin who owns a company, who's an entrepreneur by himself, who has established multiple, software companies. So that's a different perspective. So how my problem or a kind of a solution I'm thinking can be kind of a given a structure or kind of given a resource to build a product. So it cannot happen on one man's hand. So I can think of problems as a doctor, but if I have to provide a solution, I need to have help from different people. So it's important to reach out to people, create your own community of people wherein you keep kind of interacting among yourselves of how we can solve these problems. And also I think it's important to reach out to some uh, government institutions who can support this kind of an innovation. Also, there are a lot of NGO organizations who also fund this kind of a research. So it's all about having the right set of people working with you so that you can come up with a great solution. So and I mean, so in general perspective, I've just kind of I just wanted to share my example as well as kind of the basic thinking of how we have to think going forward. In terms of kind of creating something different. The usual practice or the usual doctors who kind of sit in a clinic and do practice, yeah, it will continue to go on, but I think if you want to be that 1% of people who would really kind of change the direction of the world, I think you have to think big, start innovating, work with wonderful people. And and I think you guys have immense opportunities now with uh, introduction of OpenAI, like Bard, Chat GPT, and like a lot of new things that's coming up. I think, see, what we had was like data with from Google, right? We used to Google search and collect data, but even before that, there was nothing called internet. There was nothing that we can know what's happening in US, right? So at least by the invention of internet, we started at least kind of knowing what's happening around the world by kind of looking through Google or probably what like all the search that we do now. But now in the last 2 years, now I think AI is going to take next level of approach. So you don't have to really put an effort into, it's going to bring information to you, and that too it's like the best available information on planet. So it's all about knowing the resources and kind of having the right people with you, keep innovating and stay motivated and always be passionate on what you're doing. I think with that I would just uh, kind of close my presentation here, and would like to have your questions, and probably we can interact much deeper on any particular questions that you guys have. But I think you have got a lot of opportunities. The world is all ours, and we can definitely make bigger things, sitting in your right in your place itself. So thanks for that, and let's open up for the debate or questions that you have.
Yeah, so hi. I have a really quick question. So, as you know, at Med Veda, we have like a lot of engineers and medical enthusiasts and everything. And then we all like come together to work on a medical innovation project or a research project. So right now we're trying to find some unmet clinical needs to develop our project on. For example, like a few months ago, we worked on redesigning the traditional EEG. So you know how the traditional EEG has like too many wires and everything, right? So we kind of came up with a design that makes it portable and like wireless and like kid friendly and everything. So something similar to that, in the field that you're in currently, what advancements would you like to see and what are some unmet clinical needs according to you?
Uh, See, I think still in developing countries like India, I think there are a lot of rural population, a lot of people who are still unable to afford the healthcare, or probably they don't even have an access to. So I think remote healthcare monitoring is something would have a great benefit. And also, I think reaching out to this population through technology would add great value. So I think it's important to kind of deliver the care to the people who are unable to kind of have the access to, is something that I think we can still definitely work on. So that's what I really think so.
Yeah, so would you we were planning to make this app kind of an interface for one of our projects, combining tech and medicine and everything. So do you think that that would be helpful if we kind of give the app kind of thing to the people in like the rural area?
So what exactly are you trying to kind of develop? If I understand it correctly, you're
Yeah,
working on EEG, right?
yeah, that was done. That was a previous project. I can send you the
Okay,
for it. That was like a previous project of ours.
okay,
Oh, we're trying to look for even more like different because when we were doing the EEG, our main unmet clinical need was from like a pediatric hospital in Orange County, California. Um,
okay,
and they
okay,
wanted a specific design that would help it be easier for the staff and the kids over there. And I mean the
okay.
pediatric patients. So in that
Yep.
way, we made an EEG, like a portable one, like a prototype for that. And now we want
Mm-hmm.
to step into our next project. And we want that to be in like the area of orthopedic surgery or like sports medicine. So we just want you to kind of like give us some insights on how it is right now and what kind of like projects that you want to see in the future.
So, okay, so I think that's a good question. And are you guys looking for solutions that involves technology, or it is hardcore science that you're looking into? So, if it is technology, then definitely I think remote health recovery monitoring is something has got a huge potential. So, something that can assess the recovery of a patient, so that will have immense applications for sure. But otherwise, I think, in terms of orthopedic perspective, I think the more innovative solutions are happening in terms of preserving the tissue, right? In terms of say osteoarthritis. So if we can understand the aging process of a knee, and if we can reverse it back, there are millions of people who suffer through that disease who end up having a knee replacement surgery, and it's a major surgery that not everyone would like to undergo. So it can solve a lot of morbidity, a lot of pain, a lot of suffering. And I think that is one area where I think definitely has a huge scope. So it needs, I think, biomedical engineers, it needs tissue engineering, it needs stem cell research, and I think, maybe pharmaceutical support. So if that is something that you guys are looking for, I think that's an amazing space to work for sure. And as I told you, in terms of even patients recovering from, all these problems. So patients really don't want to stay in hospital for days, right? They want to get out of the bed and then start moving. So if we can also explore options or kind of innovate with technology to help patients get out of the hospital, recover faster, and can kind of get back to their life at the earliest. So I think an application with a wearable ecosystem can something definitely I think will add great value to orthopedic patients. But I'm happy to kind of send you more thoughts on this, on what areas you guys can focus on, in particularly in the area of orthopedics. But I'm just sharing on top of my head of whatever I'm just kind of thinking about.
Yeah, yeah, yeah. Also, would you be like able to send us your email address so in the future, if we wanted to show you our projects or anything, that would be easier for us?
Yeah, yeah, absolutely. I can connect you guys to my people whom I'm working with, who are absolutely amazing engineers from IITs and other places. So they would also kind of help you through if you have got some problems that can that needs technology, that needs innovation, probably I think my connects can also help you guys to kind of come up with some solutions as a project, and then taking it forward also. So should definitely, I'll share my email ID, and we guys can definitely take it forward for sure.
Yeah, thank you so much. Since we have like 5 minutes left in the meeting, if you guys, any of you have, if you have any questions, this is the time to ask.
Yeah, oh, sorry, I think I
Hi.
can hear myself.
Yeah, I can hear you, please.
Yeah, so
Hello.
I know you talked about the new like AI and machine learning. How much do
Yeah.
you think it has already impacted your field?
uh I think not really much at this stage. I think, see, what's happening in orthopedics currently is that uh, I think when I graduated in 2017, we used to kind of we were taught to do a knee replacement surgery using conventional instrumentations, right? And then I went into South Korea. We started doing it with computer navigation using kind of softwares and other things. But when I moved to US and Australia, there was like a lot of waves starting with robotics, and I never expected that it would come to India in any time, like in the next 10 years. But by the time I landed in India last year, we had already robotics in every part of the city. And now we are doing all our surgeries using robotics. So that's a speed at which the technology is being incorporated into the medical field. Having said that, so when you say technology, when you say all these things, you're kind of mining the data. So you're kind of collecting the data through all this technology, right? The robot will always record the technology. So all this data is being put through machine learning, and there will be a day where lots and lots of data is sitting in the database, and then you start doing the machine learning and artificial intelligence out of it. You start coming up with algorithms which can predict outcomes and kind of predict what needs to be done for that patient to get the best results. So I think, to answer your question, we are not really impacted in a big way currently, but I think the days are going to come very soon that we will practice the way very much different to what we are doing now. So definitely in the next maybe 5 years or so, it's going to change rapidly for sure with the intervention of already AI. Open AI is already there. So I can see a great change for sure. Hello?
Kevin, I think, okay, go ahead. Yeah, you go ahead.
Sorry, my audio is like kind of bugged. Hold on, let me try to fix this.
No problem, please. Yeah. Does that answer does that answer your question?
Yeah. Thank you.
Cool. No problem. I think if you're guys based out of US, I think I would advise you to start kind of meeting clinicians, probably kind of reach out to some bigger organizations like Mayo Clinic, Cleveland Clinic, probably HSS. There will be cutting edge research that's happening, and I think you can do an immersion program which will help you to kind of move around the hospitals to understand what are the real clinical problems that exist, and then kind of re-engineer back, thinking about how we can solve it. As I told you, you have to always cut it down to first principle thinking or basic thinking. So once you understand what are the basic problems, and then structure it back to come up with an innovative solution. So it's all about understanding the problem first. If you understand the problem well, if you understand the right problem, if you are able to solve the right issue, I think you are going to make a huge benefit or a great outcome for your patients for sure.
Thank you so much. And because we have 2 minutes left in the meeting, anyone have any final questions? Okay. Um, yeah, so thank you so much, doctor, for being here and like spending your time to like talk to us and give us like such valuable insights. we truly appreciate you spending your time to like help us understand the field of sports medicine and everything. Thank you so much.
Yeah, I'm really kind of thankful to each and everyone, and thank you for inviting me. I can resonate you guys maybe a couple of years ago looking for, kind of inspirational kind of probably conversations so that I would like to do something different than what my peers would do. So I think with that confidence, I can clearly kind of tell you guys that you will do something really great because you are in the right path. It's all about consistently doing it, staying motivated, and be passionate on what you really want to do. And if that is the case, I think you will really end up doing wonders. And I'm like, people like me would always be happy to help you guys and, always add value to whatever you do. So with that, I'm more than happy to help you out in whatever capacity I have. I'll be sharing my email ID also. Do reach out to me, and probably we can also work on a couple of projects in future. But my heartful wishes to all of you guys for your great, wonderful careers ahead, and all the best. And have a wonderful weekend.
Thank you so much.
Bye.
Thank you so much.
Yeah. Take care. Bye.
Bye. And to everyone in the meeting, I know that you've joined because you were interested in the topic. If you've not joined Med Veda before, you can like send us a chat message and like we'll send you the details and everything. So that's that, and thank you for joining.